We're excited about our next speaker. He is going to discuss how AI is reshaping PBMs. I know AI personally has reshaped my emails, so a thank you to Copilot. I look like I write better than a third grader now. So anyway, without further ado, please welcome to the stage Serge Paris, Chief Information Officer with Abarca Health.
Thank you, Amy. I appreciate it. I just got to grab a microphone here, so. Yes. Everybody hear me? Yes, I can hear myself. Excellent. Sorry, it's very difficult for me to stand at the podium indefinitely, so I'll hopefully walk around. So, good morning. Thank you all for being here. I appreciate the participation. Hopefully we'll get some questions and some engagement. I will possibly put some of you on the spot and point around, so if you haven't had your coffee, probably a good idea to get some now. So my name is Serge Paris. Actually, Amy asked me earlier how to pronounce my name, so I figured most of you probably haven't practiced your French pronunciation lately, so Serge is fine. CIO for Abarca Health, so obviously working in technology. A little different than, I guess, the humbling experience I've had this morning in watching a lot of the presentations and the panels around, oncology and cancer care and, medication and so on. I'm kind of a PBM newbie. I've been in the business only now for 4 years. And, again, my background, or at least my history, is primarily as a software engineer. So, unfortunately, you need us technology folks to hopefully support some of the things that you do. And one of the things that's really exciting from what I'm watching is, the incentives are very much aligned as far as what I hear people saying as far as, the intention of making sure that our patients or the patients that we care for are getting the best care possible. And that's actually what we're trying to do, obviously, with the technology and how we enable our business, our clients, our members, okay? So, let's see if this works. Fantastic, okay. So, I said I already kind of introduced myself a little bit. Background, actually it's interesting because before coming to PBM, I was actually working from a primary care organization. And in the previous session, there was a lot of talk about value-based care. And actually that sort of resonates very strongly with me as well, because that's something that's super important, is how do we align incentives to make sure that we're delivering care for the right reasons. Now, that doesn't play into necessarily the AI conversation that we're about to have, but I think it underpins everything that we say or that we're doing. So, AI in PBM, why now? Well, frankly, first of all, who hasn't heard of it? No, actually, let's do it this way. Who has heard of AI, obviously? Okay. Some of you didn't raise your hands. Have you been sleeping under a rock or something? Because AI is definitely, I think, to the point where we're getting a little bit of fatigue. We're hearing it so much, right? Everybody talks about it. This is the answer to everything. Frankly, it's clearly not. It may have had a lot of promise as far as the silver bullet for a number of things, but it isn't. I think we're in the wild, wild west portion of AI discovery, what I would call the hype phase, if you will, or we all call the hype phase. A lot of things are happening. A lot of interesting things are coming. But in the previous session, there was a lot of talk about standardization and how it is that we can do interoperability and bring data together, and that requires, again, that standardization, that common model. It's not quite there yet with AI. So there's a lot of things still emerging, so we'll talk a little bit about that. We've invested, Abarca, I think probably many of you as well, in different areas with AI, some of it at the surface around efficiency, some of it possibly more vertically around optimization of clinical workflows, things like that. So we'll talk a little bit about what we've done, maybe some recommendations on how you might want to leverage it. And hopefully, what I can share with you is opportunities or ideas on how to approach, bringing AI into your organization. It's not just about turning it on and, of course, asking ChatGPT, please solve this problem for me. It's a little more complex than that. Actually, another question. Everybody heard of generative AI? Who hasn't, or who has? Okay, good. What about GPT? What does that stand for? Anybody want to take a gander? No? Nobody knows what GPT stands for. Chat GPT. It has generative in it, pre-trained transformer. It's okay, this is not going to be a technology conversation. We're not going to get down to the details. Don't be worried. I wanted to scare you a little bit there, but we'll talk about some implementation challenges and strategies. So what are things that you're going to run into? There was already mention, I've heard in other sessions, about some of the things that are challenging, such as reliability, consistency, repeatability, right? Do we get the same answers? By the way, have you ever asked ChatGPT one question one day and the next day the answer was different? Or maybe in a different thread? No? Yes? Yes? Okay, I see heads nodding. We're kind of like human beings, right? You ask me the same question 3 days in a row, I'll probably have 3 different answers. Maybe the theme or thematically it might be correct or it might be the same, but the answer and the specifics are going to be different. And that's a big challenge, right, in a very deterministic model like healthcare, where we need results that are consistent, always the same. So then finally, a little bit about future outlook. So go to the next slide here. So wait a minute, go back. All right. So we're at a digital crossroads. Sounds familiar. I think this happened many, many, many times. Oh, HL7 is going to take over everything. Fire is going to be the solution. And here we are with AI. Frankly, whoops, actually, you know what? I was looking at the wrong screen. Apologies. So it's not just healthcare that's at a digital crossroads. Frankly, it's the world. Honestly, AI, I know the promise is huge. And frankly, if you look at some of the things that have already occurred, I don't know if you're familiar with AlphaFold and the fact that they are now able to predict protein folding, which is a huge boon to the healthcare industry in the long term. These are the kinds of things that are actually going to be transformative for the industry. We're not going to get into the complexities of that because that's a much higher order of, how should I say, research, if you will, required to accomplish those things. What we're looking at is more of the utilization of what I would call commercial off-the-shelf or ChatGPT or AI models, LLMs that are already available, commercially available. So if you're not thinking about AI, even though it sounds like a bit of a pain in the butt, you need to think about it, to be honest. We will be left behind if we don't, okay? So one of the things that we're doing, and these are areas you, again, probably are very familiar with, administrative efficiency. Things like repetitive processes that we can optimize. By the way, before AI was around, we did that too, right? It's called Six Sigma or Lean or a number of other methodologies. Process re-engineering. But AI sort of supercharges that. Another thing that we do is analysis of fraud, waste, and abuse. How can we create insights that are not part of a deterministic model, things that can be connected on the fly? And then member personalization, or essentially user personalization, and that's the experience. And by the way, experience, sometimes when you think about technology, or at least when we do, as technologists, we say, the interface, right, that you're going to interact with. But that's not just that's only a part of the experience. A big part of the experience is the interaction with the physician, the point of sale, when you go to get your medication, the amount of time you have to wait for a PA. That's all part of the experience, right? So how do we improve that? Okay. Efficiency. Bots. Who actually has done some automation, whether that's, you may have heard of it as RPA, robotic process automation, or other, or intelligent automation within their organizations, or is using, show of hands? No one? I see one, two, a few. This is actually a very interesting area where you can leverage, without too much complexity or risk, an optimization of existing processes. One of the things that's really painful for organizations, at least for us, is toil, right? Repetitive work that we don't particularly enjoy doing, but also is wasteful and costly, time-wise, right? And that goes into a lot of areas. And that's what computers are for. That's what machines are for. Machines are for doing repetitive tasks with consistency and with accuracy. One of the big problems, of course, is that if you've got repetitive tasks and you're not delivering them with accuracy, you make mistakes, and then that actually flows downstream to your members, your patients, your clients, right? So what's an example? We've actually done some optimization. I'll just give one example here to give, we'll call it our MTM bot, but in reality, it's robotic process automation with intelligence. And look, a lot of numbers, I won't read them off. Let me give you the gist of it. We've improved, obviously, the amount of accuracy. We've increased the throughput, and we reduced the amount of manual intervention and human intervention required to accomplish our CMRs, right? We can do a lot of automation. I think what was mentioned earlier in the previous sessions was things like, well, how do we gather the information so that we can make sure it's available at the moment in time that you need it so that you can actually do those kinds of things. And this is what we've been doing is garbage in, garbage out. If you don't have access to the information to be able to gather it, you won't be able to achieve some of these things. So we'll talk about foundational elements required in a moment, but this is some of the just general things that we've been able to accomplish so far. These are actually a little bit older numbers. I was asking the team this morning because we submitted this deck a while back. I know that we've had the second quarter numbers. Hopefully it's improved. But I think one of the things I want to call attention to is, right, stability of 100%, accuracy of 100%. That's something that we've been able to achieve. It's not something we had before when human beings were having to copy, paste, look up things, connect information, and assemble CMRs for us. So that's been beneficial. So notable takeaway, as I said, primarily accuracy, right? And then I want to call attention to one number which it doesn't seem very impressive in and of itself, and I want to talk a little bit about it, which is that 6.75 minutes saved per CMR. That doesn't sound like a lot. It frankly isn't in isolation. I mean, does it sound like a lot to you guys? It's half the time, but still, half the time. If I were to say you have a task that takes you 10 seconds and I can cut 5 seconds off of it, and you only do it 5 times a day, it's not very valuable, is it? Can you redeploy that 5 seconds? Can you reuse it? Is that actually going to reduce your total headcount? Is it going to reduce your, is it going to improve your efficiency? Probably not. So what's important is that when you evaluate a process that you want to tackle with automation or with some kind of AI, is to understand the modality of that process and to know whether or not saving time actually is going to matter. Because one of the other problems that exists around AI is ROI. How do you measure it? How do you know you're actually getting something out of it? Because is AI free? No, probably not. No. Frankly, it's relatively expensive if you're paying for the tokens. I won't get into the details of that. You may or may not be familiar with how the model or the financial model works, but it's definitely not free, and you have to actually pay, obviously, for the capability. And you have to start offsetting that or just understanding whether or not supporting it, maintaining it, and holding all this infrastructure actually offsets the cost that you're saving from time reductions, which generally, again, are difficult to quantify. Like, that's not usually the first place that most people go when they say, I want to cut costs, is to say, I want to reduce the amount of time it takes to do something, right? However, in this particular process, our clinical staff, we're taking 2 hours a day, we're setting aside 2 hours a day, contiguous, to be able to go through all these CMRs. So in that context, by cutting it from 2 hours or 2.5 hours down to 1, that actually is reusable time. Now you have an hour that can be redeployed. Or you can start thinking about reducing, not that I'm encouraging this, but reducing full-time staff. Or taking that full-time staff and moving it to other higher order or higher value activities, right? So it's not just about pointing AI at something, it's about making intelligent decisions about where is going to provide the value, right? In isolation, a very small, measurable return may or may not provide value. So that's one learning, hopefully you can take away. Another part we've worked on, something I'm sure all of you are very familiar with, is fraud, waste, and abuse. And this has been around, or at least the analytics of this have been around for a long time. But the difference is, or what we've been able to do with machine learning, which by the way is one variable or how should I say, it's one type of AI, because AI is a very broad sort of general concept. When I say machine learning, do you equate that to AI? Curious. Show of hands for yes or no. Yes? Okay, good. Yeah, it's a subset. What about robotic process automation? Is that AI? Depends who you ask. Intelligent automation usually is referred to it. It sometimes gets bucketed, but the point is, like, there's a lot of different variations of this. AI is not just ChatGPT. So going back to this, what are we trying to do with fraud, waste, and abuse? We're trying to create models that are adaptive in real time. You can determine fraud, waste, and abuse by looking at patterns and then identifying them and simply coding for that using old strategies that are not AI-based. That actually works quite well because you can hit on 80 to 85% of what's out there with those basic models. But what's missing is the corner cases and the things that are dynamic, things that are happening in real time, right? So that's where we've been able to sort of leverage machine learning to help us improve the accuracy of our fraud, waste, and abuse methods. So it's a lot faster too. That's another piece. You'll notice that that's a consistent theme. We can do things faster. That probably matters a lot when you start thinking about things like PAs, right? I think one of the biggest problems literally that I hear about with PAs is how long it takes. Not that it's necessarily long in and of itself, it's the wait periods and whatnot, the accurate, the RFIs and so on. So those are the kinds of things we're looking at as well. But in the fraud, waste, and abuse model, much faster, greater accuracy, and ultimately with the same quality of results, and actually higher quality of results. So, no questions there? Okay. And then finally, the most interesting area that you all want to know about is the generative AI or the chatbot. I hate referring to it as chatbot because I think that makes it very sort of pedantic or simple, but how do we use this generative AI capability as provided by the Claudes, the Geminis, the ChatGPTs to improve the experience for members and even for staff or clients or partners? And a lot of that rests on, first of all, laying the foundation. So again, talk about data integration, interoperability. I think Jenny earlier say, I wish the one thing, if I could have it, would be to have interoperability or standards across the board so that all the data could flow between payers and providers. And of course, that would also help us significantly to be able to surface these capabilities, right? So chatbots are what? They're obviously providing a way to have a human-like or an English language or any language, frankly, not English only, a language interaction with a system that's non-deterministic, that allows you to kind of free flow and go through things, right? It's actually very, how should I say, engaging for somebody who actually interacts with it. But beyond that, it also provides an ability to, again, dynamically gather information and surface capabilities within your system that you may not have even imagined, right? So personalization, I won't talk about necessarily the memory models and things like that are needed to make that happen, but there's certainly things that are emerging right now in AI that it would be good for you to pay attention to if you're not looking at it right now to see what's coming, so you can understand how to sort of lay the foundation. So there's some gotchas there when it comes to implementation. Number one, data security and compliance. Obviously, a very big concern for everybody when we talk about healthcare. PII, PHI, et cetera. You may or may not be aware, but if you're actually working directly with OpenAI, the provider for ChatGPT, they won't sign a BAA with you, which means that if your staff is putting PII and PHI into the chat, you have no idea, or they have no responsibility to protect it. So that's a little bit of a challenge. And nobody wants to get hacked, and nobody wants to have data leak, right? Security is not sexy, but it's damn necessary, right? So it's very important. Compliance-wise as well, you've heard of some small company that got sued for rejecting PAs with AI. There's compliance requirements, there's things like that you have to be worried about as well, right? Interoperability. By the way, I wasn't, that was already on the slide deck before. It's a word that's used to be, seemed to me anyways, to be very technical, but it's floating around a lot, which is nice to hear. But interoperability with existing systems. How do you surface information through your AI if you don't have a consistent or standardized mechanism by which to surface it, right? Organizational change. This actually is something that's very underrated, it seems like to me. A lot of big organizations, there's been a study published actually by MIT very recently that talks about the adoption rate, and generally, people are much more apt to adopt private instances of chatbots, for example, and are using ChatGPT privately than to use the internal enterprise ones, often because they're not as dynamic or as flexible. But you need to create a culture, and admittedly, even us, internally at Abarca, we've launched on a program to create adoption and try to get everybody to use AI wherever possible and where it makes sense. And it's not an easy thing to do. We realize there's a number of stumbling blocks. How many of you actually have AI really with a good foothold in some of your processes today in your organizations, where you feel like you've got a fair amount of maturity? No one. Wow. Either you're very hard on yourselves or you're being realistic, right? Because the promise of AI, first of all, it's not the silver bullet, as we said earlier. It doesn't do everything for you, and I think we're realizing that now, right? The promise sounded really good at first. I imagine you also probably get 100 emails or 10 emails a day, 100 emails a day on the next latest and greatest AI shop that's going to sell you something that's going to solve all your problems, right? And that's probably not realistic either, right? So finally, stakeholder trust and adoption. You'll see if you're signing contracts for your business, if you're actually having to interact with clients and or potential partners, there are a lot of AI policies and clauses that are now coming into the contracts, right? Where you must, number one, disclose what it is that you're doing with AI. There's been lawsuits already of lawyers preparing cases with AI. That's not unusual, but it's part of the growing pains that we're going through. And that breaks down some of the trust. How many people here actually believe the answers that you're getting from these generative AI bots are accurate, let's say 90% of the time? Or let's say more than 90% of the time. Okay? More than 80% of the time? Okay. More than 50% of the time. Okay, yeah. How good do you feel about making business decisions when you're getting 50% accuracy? I don't know. Yeah, me neither. I see you shaking your head because it's very difficult, right, in a business environment to make decisions based on 50% accuracy. It's just not good enough, right? So, go over to the right here. We talk about deterministic versus non-deterministic. This is the difference, right? When you're talking about generative AI, especially, non-deterministic means I don't really understand how the decision was made. Like, that's another problem with AI today. There's no real clarity, at least not yet, with most of the models that are available, to understand or to have transparency around what actually made the decision and how the decision was made. What were the data points used, et cetera? What was the path through the maze? The kind of way I like to refer to it is that every decision is ultimately a path through the maze. So you got to know what the maze is, and then you got to know what the path is, right? Both of those have to exist. Which actually brings, I didn't mention hallucinations, but that's the 50% accuracy I think that some of you are raising your hand about is hallucinations, right? AI is actually very good at giving you answers, even though they may not be accurate, because it's actually incentivized, if you will, the way it's designed, to always give you an answer, whether it has the information to answer it correctly or not. And that's a problem, right? We've actually done a number of internal projects, and this has been a big battle, a big uphill battle, to understand how to minimize those hallucinations or completely eliminate them. I haven't successfully done that. I don't know that anybody has yet. So you have to move to this specialized agent over generalist model. What does that mean? Earlier, I think it was Justin that mentioned agentic AI. Here's another query, right, or another question. Agentic AI, I think I already asked that one. Did you guys heard agentic AI before? No? Okay. Think of it as specialized large language models or GPTs that will do very specific tasks. By moving away from a generalized model, like if you've got a specialist, like as a human being that can do something, let's say bomb disposal, right? They've got very specific skills. It's kind of like saying, well, the difference between, well, if everybody's a pilot, who's a helicopter pilot, who's a jumbo jet pilot, or who's a jet fighter pilot, is there a difference? you can nod and say yes. There's a huge difference. I don't know if there's any pilots out there. I'm privileged enough to have gotten my license, so I know flying a Cessna is not like flying a jet fighter. And so it's the same thing here when we talk about the model that we need to go towards in order to optimize the AI, is that these specialized agents need to have very specific tasks so you can manage what they do and how they do it, rather than having this blanket sort of approach, right? So, what are some recommendations in order to think about how you might adopt AI? So first off, infrastructure. Interestingly, a lot of the standard best practices around software development, whether that's what we call microservices or API-based approach, proper decoupling of systems. Please stop me if I'm sounding too much like a tech, if it's techno-babble, but I'm sure you've probably heard your IT folks say this before, right? Proper structures in your data. Those matter because those underpinnings are what's going to allow your AI to work. I said earlier, garbage in, garbage out. If your structure of your systems, your data is not good, you can't just layer AI on top of it and expect good results. It's not going to happen. Just think of it as if somebody were walking in the door to your organization tomorrow, how much time does it take them to be effective? And part of that measure is on the individual, but the other part of it is how much of what you have is either clearly documented or easily understood, or is it all colloquial knowledge or tribal knowledge? If your organization is primarily tribal knowledge based, you will struggle to get AI to work. Because can AI read your minds? That's a question. Yeah, not yet. Yes, not yet. Oh gosh, when we get there, I'm going to be very worried. But yeah, definitely not today, right? So think of it as AI is just more of a Iron Man suit, not Iron Man himself, right? It's an augmenter. It allows you to accelerate things, but it doesn't solve all the problems. It can't do the thinking. Even though they call it thinking machines, it's not, right? Second thing we do, and I recommend that you do as well, this is not rocket science or necessarily earth-shattering, right? Pilot and test and focus areas. Don't make massive investments in things that you might think you're going to get across the finish line. It's going to wind up in probably a big mess, a lot of dollars spent and not a lot of results. And eat your own dog food. As you're testing things, the risk, especially in healthcare, when you're exposing capabilities to your members, there's lawsuits, there's compliance, there's all kinds of other things, right? Make sure you test it internally first, as much as you can. Third point for adoption, it's really important. Cross-functional collaboration. Those of you that were around in the 90s and 2000s, there was a time, I remember in the dot-com bubble, in the late 90s, mid-90s, early 90s, technology took a turn where businesses were driven by the tech. And there's a danger here as well because AI is so eminently, seemingly powerful that a lot of people are kind of seeing like, let's listen to IT and what they're telling us to do with AI. Please don't do that, okay? Please look at it from a business perspective and a value proposition, not on what the technology is for the sake of technology, but what is the business problem that you're trying to solve, right? And that requires collaboration, right? Clinical, tech, ops, business, whatever, right? Everybody in the organization. It cannot be just about, this is cool technology, and we want to apply it to everything. You've probably heard the expression, when you have a hammer, everything's a nail. Well, there's a lot of people out there right now who are saying AI is a solution to everything, and so, yeah, and those are mostly the tech people like me. Not that I'm saying that, but, it's very easy to go down that slippery slope. So, number 4, invest in training, right, and cultural readiness. I mean, AI is not the first thing that comes along that's new, and I'm sure, in the PBM industry, going to D.0 was a pain in the butt probably, right? And coming to F6 is now like, oh gosh, we got to make all these changes. Look, change is hard. It's not easy. It's not something that happens naturally for people. So it requires that you create an environment that allows that to happen. There's some grassroots movements that you can do. There's also training formally. I mean, that's maybe 10% of it. And then there's the on-the-job training. But what's important, or at least what we've realized, is that by simply handing the tools to people, we didn't really get good results. If I just hand you this really complex machine that's got a flashing cursor and you have to somehow start interacting with it, you might be a little bit lost, right? If you're not a technology, geek or something to begin with. And people will get discouraged very quickly because if you don't get results, you're going to give up. Say, well, I can get my job done without this thing because, I don't know, I tried 2, 3 things and it didn't answer what I expected, so I moved on, right? So you need to get people to understand. And you also need to understand what they need. Like, what is the business that needs, right? We don't need AI for everything. It's simply not it's not the answer for everything. It's a powerful tool, but again, it's not solving everything. Now, obviously, as I said, those emails that are flooding in every day are telling you otherwise, but I think you know better, right? And then the last piece for adoption is really focusing on accuracy, repeatability, and validation. So nobody here is Facebook. Does it matter if the meal you are posting gets actually seen by all your followers immediately and accurately? Maybe if you're competing somehow with your friends on which meal looks better, perhaps. But in general, that's not that important. In healthcare, do we have that luxury? In PBM, if you go to the point of sale system and you get a medication, it's the wrong one, is that a problem? Yes, thank you. Yes. It's not good enough is not good enough, right? Or close enough is not close enough, is not good. We need accuracy, we need repeatability, okay? So what's in the future? Well, I think that many of you are probably thinking about this, or actually I'm curious, how many of you have a roadmap or are planning AI projects or are aware of AI projects? So I see 1, 2, oh, okay, good. So lots of people are planning. I'd be curious, is anyone willing to maybe just shout out what they're working on or what they're looking at? Prior auths, yes, that's a very famous one, very popular one. Other prior auths? Maybe just show of hands. Prior auth, okay. Any other areas of interest? RFPs and proposals, yes, repeatable process where you can get data from, actually there's tools out there that do that today, they're fantastic tools, but that's another area, right? Repeatability, understanding the nature of the question, providing good answers to it, hopefully. Generative AI is actually very good at that. That's why I think lawyers have limited time before they'll be at least significantly reduced in number or extensively augmented, or maybe their rate per hour will go down. So there's a lot of projects out there. Have you done the ROI calculation around the PAs? I'm curious. Not yet? Yeah. So a lot of this is like, again, when you start with this new technology, it's the hype cycle, right? We're trying things because there isn't a lot of proven results. There's not a lot of proven ROI. In fact, does anyone here have built or know of a reliable quality assurance process around generative AI results? So in software engineering, we call that unit testing or golden master test data sets so that we can repeat things and know when we change something if it broke or if the results are what we expect. In generative AI, there's confidence scores, right? And other sort of ways to look at it, but it's very loose, right? Again, leading to or leaning towards, it's been difficult to quantify the results and if you're getting what you need. So when you let that bot that you built out into the world, whether that's PA or otherwise, like you're not going to be watching every transaction that it does. Can you guarantee that the results you're going to get is what you want? And I'm not trying to be a naysayer here whatsoever. I actually have a big firm believer that we are still in the growing pains in the emerging space of AI, and this will get solved. It's just not there right now, right? So be cautious as you go down that road. And if you're looking at PA, you probably have already thought of this, try to think about accelerating the delivery rather than denying claims. That's the goal, right? Making sure that you can facilitate or reduce friction on the PA, gather information, get it to ultimately a human reviewer if there's any doubt whatsoever. So, obviously with PBM, reactive to predictive care models, this is back to the beauty of AI being able to connect dots that otherwise you wouldn't have connected in advance, right? That's a great opportunity. Empowering real-time decision-making. What if you can also apply, if you can, and when we can apply that decision-making in real time will also be extremely powerful. It's risky right now, but it's coming. Better collaboration, hopefully through that interoperability that we talked about, but AI also has the ability to transform that data and connect it in a way that we don't currently have, right? That requires a lot of what I would call plumbing, right? Either that be APIs or interoperability or file exchanges or whatever it might be. And then, hopefully, reinforcing value-based outcomes, right? Giving the patient or the member, right, the results or the benefits of what it is that's being built, right? So, a couple of takeaways. Whoop. Yes. So AI is reshaping PM across operations, risk, and engagement. Would you agree? It's certainly the hot topic right now. As I said, there's a little bit of fatigue because it's on everybody's radar and everybody's talking about it and everybody wants to invest in it. But now is the time to adopt and scale responsibly. Yes, give it another 12 months. By the way, how many of you have been watching how quickly things have been progressing? Like now with ChatGPT 5, I don't know if you've noticed the difference or if you've interacted with it. It's fairly material. It's a bit nuanced. But if you look at the back end on some of the things that are happening with the cost and the speed, it looks a lot like Moore's Law. So anybody know what Moore's Law was or is? No? Moore's Law in computing is that the processor speed was going to double in capacity every 18 months, and that started in the 70s, and it stayed true all the way through until, don't quote me on this, but in the last 5 years or so. And we're seeing cost reductions and performance improvements in these AI models that look very similar to that. Meaning, today it's expensive, tomorrow it won't be. And what cost 12 months ago would have cost $100,000 is now $1,000 and going down. So that's great because that's going to make it ubiquitous, affordable, and something we can actually use, right? It won't be only the biggest and largest that can actually take advantage of it. And then ultimately, right, strategic use of AI can transform member and stakeholder outcomes by creating a better experience. And again, that's holistic, right? That's from proverbially the cradle to the grave. I don't want to call it that because we're in healthcare, but all interactions, how the data goes, how, if we're PBMs, we're providing services to the members, we're providing, looking at their history, giving them medication, hopefully doing MTM, et cetera. All of those things can be connected together and then ultimately provide better results or better outcomes. Okay. That's it. Any questions? I already asked you all the questions, so I guess you guys probably don't have any for me. No? Okay. Well, thank you for listening. Oh, wait. Oh, question. Fantastic. Please, yeah, go ahead. I think that we...
So if it's getting cheaper so much faster,
Yes.
Wouldn't that make any current ROI computations date very quickly?
Yes. Well...
And wouldn't that argue for just waiting?
Good question. So, what actually is valuable is not necessarily the computing power, it's the algorithm, right? And when I talk about algorithm, it's how you connect the data to the process. Because, so in AI generally, right now, in generative AI, what is the magic is the prompting. You've probably heard of prompt engineering. The prompts will not change necessarily, and you need to develop those, and they require a lot of reps. You have to iterate to get to the right results. The underlying infrastructure cost may be large today, but as it goes down, you'll reap the benefits of that with no additional investment. Because what's difficult and what you need to bring to the table is the prompts and the connectivity, right? So think of it as your car is not going to get any more efficient. You're going to fill it up with gas today, and it's going to cost, let's say, $150 to top up the tank. And in 3 weeks from now, it's going to cost $20. That means maybe drive the car less today, but you still need it because you're going to be doing things with it. Then you'll be able to drive more miles with it at a lower cost later. So the investment idea is not lost, at least not in my opinion. It also means you have to make more conscious decisions, I think, financially, as to where you want to invest. And that's a good thing, right? Because when you talk about very cheap technology, sometimes that's a distraction, right? Because you're not making good, sound decisions from your business perspective. Because it's not just the computing cost. It's the personnel cost, it's the opportunity cost, it's the things that you're going to miss out on and or deliver incorrectly possibly if you don't make the right decisions. So my recommendation would be like, sharpen the axe now, get to learn the models, because technically speaking, as far as your interaction, and when I say your, I'm talking about your organization and how you build your solutions, that is not going to change significantly from what it is today. It's going to be something that's reusable. Does that make sense? Cool. Yeah, you're not fully agreeing. That's okay. You don't have to. But it's my opinion. Any other questions? Okay. Well, thank you. Do I have an off button on this, or do I just...